Pai, consultant cancer surgeon at Heritage Hospitals in Varanasi. So I'm here to talk to you about pancreatic cancer. November is the Pancreatic Cancer Awareness Month. So what is pancreatic cancer? Pancreas is an organ which is responsible for the digestion of your food in the upper part of your abdomen. And a lot of juices are formed in this organ and which are released into the intestine, and this helps in the digestion of sugars and fats in the body. So when there is a structural genetic alteration in the cells of the pancreas, it can lead to the formation of pancreatic cancer. So there is a complex system of glands and ducts which the pancreas is composed of, and when cancer occurs in this is known as pancreatic ductal adenocarcinoma, which is the classical type of pancreatic cancer. There are other rarer types of pancreatic cancer, such as the pancreatic neuroendocrine tumor, which was brought to the limelight with the sad demise of Irfan Khan, the famous Bollywood actor. And also the cystic tumors of pancreas are other lesser known types of pancreatic cancer. So pancreatic cancer is a very heterogeneous group of diseases, and different diseases have different outcomes. So pancreatic cancer affects whom? So the most common age group, that is for the classic pancreatic cancer, is the age from 55 to 85 years, and it's more commonly found in males. So the strongest risk factor for pancreatic cancer is known to be family history. And the more number of people in the family who are affected by pancreatic cancer, the higher your risk of getting pancreatic cancer. Although family history is the strongest risk factor, it is not the most common risk factor. Majority of cases of pancreatic cancer, the cause still remains unknown. One of the strongest environmental causes for pancreatic cancer is smoking. That is smoking of BDs, cigarettes and cigars. And this is found to significantly increase your risk of pancreatic cancer. Alcohol in mild or moderate consumption has not been found to be a strong risk factor, but heavy drinking, that is like 8 or 9 drinks a day, has been found to significantly increase your risk of pancreatic cancer. There are also some chemicals which have been found in the metal industry and aluminium, and even in the dry cleaning industry, some kind of hydrocarbons and polycyclic aromatic hydrocarbons which have been found to increase a person's risk of having pancreatic cancer. So these are the environmental factors which contribute to an individual to get pancreatic cancer when you don't already have a strong family history. Chronic pancreatitis, which is a chronic inflammation of the pancreas, and diabetes, that is type 2 diabetes mellitus, these have not been found to cause pancreatic cancer per se, but these have been found to be strongly associated with pancreatic cancer. So it's hard to say whether it's a cause or effect, but there has been found to be a strong association. So what are the most common symptoms? So the common symptoms of having pancreatic cancer are, one is of course jaundice, and this is because when there's a tumor in the head of the pancreas, it causes compression of the bile duct, which leads to jaundice. The other symptoms are weight loss and pain, abdominal pain or back pain. And this new onset, like when an elderly person develops diabetes or develops a sudden attack of pancreatitis, this should also raise the suspicion for your doctor to look into the possibility of having a pancreatic tumor in such an individual. So when patients present with these symptoms to us, what do we do as oncologists? So the first thing we do is ask for some blood tests, and we also ask for a good quality CT scan of the abdomen with a pancreatic protocol, which helps us identify the tumor in the pancreas and helps us evaluate it thoroughly. So a biopsy is not always mandatory in pancreatic cancer. Your oncologist may offer you surgery even without a biopsy. Sometimes in some patients who present with jaundice we advise the patient to undergo a biliary stenting, a stenting of the bile duct before we offer the patient any treatment. That's in select cases, depending upon individual to individual, it differs. So the treatment of pancreatic cancer is multimodal. That is, there is always a group of oncologists who are involved because these patients will require sometimes surgery and chemotherapy in different kinds of permutations and combinations, and sometimes they're even offered radiation. So, surgery is the best chance for cure in pancreatic cancer, and surgery is offered to an individual when three criteria are satisfied. That is, one is the patient is when the disease is confined to only the pancreas and it's not spread to anywhere else in the body. Two, when it is free from surrounding structures, that is, the surgeon is able to take the tumor out completely. And three, that is, the patient is fit to undergo the surgery. So it's important that all three criteria are fulfilled before an individual is offered surgery. And very often after surgery, patients are offered chemotherapy as well, because majority of the tumors which come to us do not come in their early stage. Radiation is offered to a few patients as well if the case requires it. So the best chance of cure and long-term survival is if we catch the disease early. So early diagnosis and the right treatment by the right team, by a good team of qualified oncologists with treatment in a timely fashion is what is important to be cured of pancreatic cancer. For any more information, you should talk to your oncologist right away. Thank you.